Good afternoon, everyone. Gareth Presch, founder, CEO of the World Health Innovation Summit. I am delighted to welcome you to WHIS 2024 online. This is our fifth session today, Women's Health, and I am delighted to welcome our esteemed guests and colleagues, thought leaders in this space. Let us dive straight into a round of introductions. And Meghna, perhaps I'll come to you first. You could give a short introduction and maybe a little bit of background about yourself. And also, just to say to any of the audience, if they want to ask a question, please do pop it in the chat and we'll take the questions as well. So, Meghna, over to you.
Super. Thank you, Gareth. Thank you for inviting me to the summit, and many greetings to everybody joining us here today globally. I'm Meghna Joshi, and I'm joining you today from Basel, based in Switzerland. I'm a clinical pharmacist by profession, so I've worked many years in frontline clinical care within the NHS, both at local, regional and national level, very closely with departments of health at the time, looking at sort of transforming the health systems and creating more equity and access to healthcare within NHS services. And this has sort of led me into what I do now. I'm a global health specialist, and I work very much as a healthcare consultant on national and global projects, both within high and low resource settings, to make health and well-being more accessible and equitable, globally, but also to address some of these gender challenges that women face, both as users of a health service and as service providers, so that we know in many countries women tend to make up the bulk of the health workforce, but they're often not seen in leadership or representative positions. So I work in some of these spaces as well. I'm also part of the founding team of Women in Global Health, the Swiss chapter, where we're actively advocating on inclusivity and leadership for women, both within health and other sectors at national and global forums. And I'm very excited to be here today representing WHIS, where I'm working with Gareth and developing our global health and global strategic partners and leading on the women's health sector, particularly around this social impact and health and well-being space. Thank you. Back to you, Gareth.
Thanks, Meghna. Let me go to the clinical setting. Dr. Khadija, thank you very much for joining us. Please, a short introduction and also a bit of background on the work you've been doing as the founder of ACAIA.
Sure. Thank you very much for having me once again. Apologies, I am actually at work in the hospital, so in case a couple of members of staff walking around, please bear with me. But yeah, my name is Dr. Khadija. I'm a junior doctor in the NHS, currently working in a hospital in North London. But aside that, I'm also the founder of ACAIA, and ACAIA is a non-profit organisation, both UK and Ghana registered, focusing on the education, health and empowerment of young women and girls in Ghana and soon to be the UK as well. In addition to that, I also am the founding member and trustee for the charity Melanin Medics, which is based in the UK, which looks more so around equality, diversity and inclusion of healthcare and medicine here within the UK, taking a look at some of our health inequalities as well as ensuring that we have more representation within medicine. So that's a very brief introduction to myself.
Thanks a million. Vanessa, thank you for joining us. Tell us a little bit about yourself and a bit of background and the work that you're currently doing with the AMR narrative.
Yeah, thank you so much, Gareth. And obviously we go back quite a long way. I think we met each other about 8 years ago. Yes. And so, yeah, very excited to be joining you again and for being here. So my background is I'm a patient survivor of AMR. I had a facial reconstruction in Johannesburg, South Africa. And when I finished that facial reconstruction, one of my biggest frustrations were that I had battled 3 years of infections, resistant infections during that time. And so in 2013, I also had a marketing background. I'd worked in marketing for about 18 years at that time. And I got online and I started to advocate. So today, what I do is I work in policy making. I'm currently the chair of the WHO Task Force of AMR Survivors. In 2022, I established the AMR narrative online. And today it's now a registered charitable incorporated organization in the UK working globally. And our specific focus is on developing advocacy capacity and raising awareness and building a global community around AMR. And I also, like I say, besides that, I also speak at different conferences. I spoke earlier this year at the UNGA multi-stakeholder meeting. It was, for me, my main focus was on patient public involvement and engagement. And of course, women are a very big part of that. So thank you so much for having me again.
Yeah, thanks. And let me just put my first question to you in terms of women's health and the challenges. And I mean, you very much embedded within the health system. You understand it, and even from the AMR perspective, like, what are the biggest challenges and gaps in women's health today, and how can we address them to achieve gender health equity? I mean, we've just had a recent report in the UK. 700,000 women haven't got access to women's health facilities, for example. But from your perspective on the AMR narrative, where do you see the biggest challenges?
Well, if it's connected to AMR, I think that we need to understand that women are likely to interact with the healthcare system due to life cycle events such as menstruation, pregnancy, and menopause. Being a woman myself, I understand that. And this can lead to a higher frequency of antibiotic use. This increased exposure makes them more susceptible to AMR. Women also have more medical interventions, which can increase the risk of acquiring resistant infections in healthcare settings. So the more you're in hospitals, the more you're exposed to hospitals, the more chance you have of acquiring a resistant infection. And then certain other conditions are also more prevalent in women. So, for example, urinary tract infections, which are often treated with antibiotics, which can contribute to AMR as well. And of course, coming from Johannesburg, South Africa, in low and middle income countries, women might face additional risks due to the inadequate sanitation and water quality, particularly during childbirth or household chores, increasing their exposure to resistant pathogens. I think there's also very big gaps in research and data. Meaning there's less understanding of how AMR affects women differently from men, and we need to really take charge in terms of understanding that. Socioeconomic disparities can exacerbate the impact of AMR on women, particularly in terms of hygiene facilities, healthcare and education. And AMR and reproductive health, as women, we get pregnant, we have to go through, reproductive health outcomes. And what is the impact of that in terms of maternal and neonatal health? And I think also, when we start talking about policies, I've worked in policy making. Do we include the gender gap enough? Do we try to understand that enough in terms of national action plans? So on. So, again, I said I've spoken from an AMR perspective, but of course, women's health is so much more. Women's health is so much more, and it impacts so many other diseases. So, I think that would be my basic answer to that.
Thanks. Meghna, let me just come to you. Women's health is so much more. It's we've got a huge area to try and cover here. From your perspective, is there any recent developments, advancements in women's health research that you believe could significantly improve health outcomes for women? Maybe try and, set the scene for those who are tuned in, because there is a huge disparity here in terms of women's health and even research.
Definitely, it's a great question. Thanks, Gareth. And yes, there have been, over the past sort of few decades, as we've seen women grow more financially independent, move into sort of more leadership and representative areas, we're definitely seeing advances in women's health that's been slowly building momentum over the past few decades. I would kind of categorize it in sort of three core areas. For example, around the medicines development piece, a big piece around diagnostics. We're seeing a lot of research and advancements in there. And then some of these bigger societal changes, and Vanessa touched upon them briefly earlier. But if I look at some of the areas, say, for example, in drug development, that's looking to the research that's going in to meet the needs of women, we do know that historically there's always been a lack of women's focused research. Like most clinical trials or medical studies have been male-centered, sadly, because we have hormones and we cannot be consistent throughout the time of a trial. But it often also overlooks the biological differences between men and women. And only 5% of women's health issues are specific to reproductive health, whereas we know that there are so many other conditions that affect women disproportionately, for example, multiple sclerosis. And the research into that hasn't been as wide and as deep as it could be. But now we're seeing a lot of changes within these areas. There is more research and investment going into looking at gender specific or sexual specific differences between men and women, and targeting things like drug doses, making them safer for women to use and clear from their systems, or developing novel formulations such as single dose vaccines, which would make, for example, cervical cancer prevention more accessible worldwide. So these types of small things are coming in, but we're also seeing advances in sort of drug delivery processes, for example, biodegradable implants or discrete microarray patches that are expanding the options for women so that they're longer acting, they can just have them put in for a period of time and then get on with their lives. And this is actually quite helpful across the spectrum, and also my area, which is particularly in the underserved regions. And we're also seeing advances in diagnostics, such as non-invasive prenatal testing, which can sort of detect a wider range of genetic conditions earlier in pregnancies, and then help families with the better information for managing any challenges. And then more recent research that I've seen, I was really excited to learn about this at a conference I was in Switzerland last year, where there is quite a bit of, research into the vaginal microbiome, which is leading to both new treatments for specific conditions, but also a better understanding of the microbiome and how it differs globally. So there's, advancements that are looking at which products work best for women from different ethnicities. And this is quite groundbreaking, because often we don't consider some of these wider aspects in women's health. And also clinical trials are changing to ensure that women are involved as a standard outcome. Simplistic, I know, but it is now becoming more and more standardized. And I was really excited to learn about WHO adopting the SAGA guidelines. And for those, this was something new for me, but these guidelines have been around for over 10 years, and they've been advocating specifically for sex and gender equity in research. And now WHO just this year has finally adopted them. And this kind of sets the benchmark that sex and gender should be reported in all health research, design and outcomes, which hopefully going forward is going to really change the outcomes for women. And then
please continue, please finish off.
Yeah, and I was just going to pick up on some of this last little point where we're seeing research really making a change at the societal level. So Vanessa gently touched on menopause and all these different issues, and we are definitely seeing that with the data that we're bringing to the table and the research that's gone on, there is a change within the society and what we want out of these societal changes for women. For example, we now know that the impact of menopause on our economy runs into the billions, and we need to address that. We can't have all these highly trained women in the workforce leaving because of a health condition, and it should be treated within our societies. So we're seeing menopause health policies come into play across societies and improving the financial outcomes for women. hormonal health has been shown to have a significant impact for women, whether they are at puberty and unable to go to school, which then impacts on their later career choices, or as I mentioned at the other end, where they're in menopause and potentially having to leave the workforce, which then has a financial impact. So these societal changes now are slowly changing within this health research space. And the other two bits I just wanted to mention was we're slowly advocating for the removal of the pink tax, which many of us will know, where products, menstrual health, hormonal health products, are unfairly taxed and now being seen as necessary for our health as opposed to nice to have. And then from a WHIS perspective, I just wanted to mention that we're really invested at looking at how we can work with partners to both improve sort of the women's health space and well-being across many different sectors. Thanks, Gareth.
Yeah, absolutely. And let me bring in Dr. Khadija. I think what Meghna's been touching on and what Vanessa's been touching on, and you're very much on the ground in Ghana and across Africa, is this educational piece. And certainly from my perspective, I have two young daughters, 8 and 11. And even yesterday, I was telling her that I was hosting this event today, and you'll be amazed. She was telling me that I have to be on YouTube Shorts. So what I wanted to ask was, what role does education play in empowering women to take charge of their health, and how can health systems better support this? Now, I know we talk about health literacy, but I don't think that gets down to the granular level. How can we address that?
Definitely. I mean, I think this is a really great question that you've posed here, because of, how much power education has, and the role that education has in women's health can, it takes several different roles. First is understanding that, as I mentioned, knowledge is power. Educating a woman. There's a famous saying, usually when we go into our schools to educate our young ladies in Ghana at the moment, they always mention how they are made to understand that when you educate a man, you're educating an individual, but when you educate a woman, you're educating a whole nation. Educating women with the knowledge in order for them to make informed health decisions, understanding their rights, being able to advocate for better care when it comes to areas like reproductive health, nutrition, even mental well-being, is very crucial in understanding how education has that much of an impact on women's health. Another thing is also when it comes to breaking taboos and stigma. In the context in which I work in, when I am around with the team in Ghana, there is a lot of stigma, especially surrounding menstrual health and also even sexual health as well. So in order to break the stigma, it is providing education, it's providing that evidence-based facts, the evidence-based knowledge, the evidence-based research that has been gathered to show actually it's not true that maybe you, for example, one of them is you can't drink cold water, or you can't you can't have a warm bath if you're on your period. Some of these notions are ingrained within children as young as 9, 10, 11, just starting their periods. Some of these stigmas that exist, where we then come into play and actually break those taboos so that the women understand and feel empowered that actually this is indeed the case. And if you are experiencing XYZ, you need to make sure that you seek the necessary healthcare available. Another point is economic independence. We are seeing, I guess, a change in the landscape of things where even more so, especially in Ghana, there is a large proportion of women being entrepreneurs, women being the providers for their home, women having small businesses, whether it be selling in the market or being, for example, a tailor within their local community. So women have that earning potential, but then it's that health education that I guess provides them with the ability to then prioritize and also invest in their health and also their families, because we know that if a woman is educated, it's not just for herself, but also for her children and the rest of her family. So that leads into intergenerational benefits that, will take place. A woman will prioritize her children's health and education with the knowledge that she's therefore gotten. And for example, this leads to making sure that your children have the necessary vaccinations. If any issues arise, you know which health facilities to also then go and see. And the second part of your question is how can health systems support this? Well, it's all well and good that as a grassroots non-governmental organisation like Akaya, we go in and provide the education, but also our health systems need to be a strong backbone for us in order to support, the education of women in relation to their health. So when we look at the school curriculum, there is a huge gap, especially when it comes to women's health and educating the students. So being able to partner with educational institutions in order to make sure that the health literacy is embedded within the curriculums at suitable amounts, which will cover critical topics like reproductive health, nutrition, mental well-being, especially at a young age, so that the women, the young girls, are able to understand as they continue to grow. Then some of our approaches, I would say, aren't always culturally relevant. So it's about being able to build systems in partnership with individuals on the ground, in partnership with local community authorities, to make sure that, okay, whatever system or method of approach that you are adopting should be able to meet the needs of the community that you are being served, that is being served, in order to build the trust and reliability. Then another huge thing is accessibility and also affordability. I think, Meghna, you mentioned about the pink tax in environments, especially I know for a fact with Ghana, sanitary pads, anything women's health, menstrual products, there is still a tax being placed on it. And it even goes to the extent where I then draw comparisons between the UK and Ghana in purchasing these products. And when you draw that comparison, it's actually a bit more expensive in Ghana as compared to the UK. So sometimes we find ourselves having to ship resources off to Ghana in order to provide the girls with this, because it works out better cost-wise with the donations that we get. So when you think about it like that, it's actually quite unfortunate that I'm having to bring materials across to the other side of the world because it's still more expensive within the countries itself. Work is being done to sort of eliminate such taxes on products. But then you just think, like, why does this even have to exist in the first place? It's a given. We don't choose to have periods. We don't choose to have menopause. But again, it's like we're being punished because we do so. So accessibility and affordable care is another thing that health systems can do to support us. And then I do want to say technology. Health tech, especially within women's health, is really booming. And I think underserved areas in terms of technological penetration, it's really growing. A lot of individuals are now sort of being able to have access to their phones, even when it comes to now having a smartphone. So it's about perhaps using technology to disseminate accurate information on a wide scale, so that women are able to be connected, educated, and also have a way to reach their community health advocates. And lastly, empowering women to pursue leadership roles, for them to also lead health initiatives and advocacy efforts when it pertains to our health, because we have that lived experience in order to bring about change and affect policy. So I would definitely say education plays a huge role, and there are so many ways in which health systems can help support this.
Thanks very much, Dr. Khadija. And I wanted to just touch on the digital health aspect. And I just wanted to ask Vanessa, because Vanessa, I mean, you use digital means to really paint the narrative around AMR. Perhaps you could just give us an insight into like how that can be utilized and embraced to enhance women's health services and accessibility.
Sure, yeah. So I think that, first of all, I had an upper hand. I had a marketing background, and I understood the use of digital medium, and I think that this is very, very important to understand. If you're going to reach out to the communities, a greater community, we need to be looking at things like the digital divide. In other words, training people how to use these digital platforms effectively, especially social media. So for me, it was a case of getting out of a hospital bed, at a point where I was almost dying, to having that knowledge, to getting online and to reaching out to healthcare professionals, policymakers, and so on. But as I said, that doesn't come naturally to everybody. So again, it goes back to education empowerment, how to use these platforms. And it is something that we, the AMR narrative, are heavily focusing on, is, how do you do that? You might have this amazing message that you want to come, bring out to the world, but if you don't know how to use the tools effectively, you're not going to be able to reach the right people. So again, I had an upper hand in that. I think also, what was said before was, how do we monitor? How do we data collect? So one of the things that came across my mind was, when I had my infection, I couldn't report on what was happening to me at the time. So, also that kind of thing, if we're going to start releasing mobile applications into the world, we need to have a little bit of digital training in that section as well. So, and of course, as we know, social media platforms are so powerful. The internet is so powerful. Let's kind of go away from social media platforms for a minute. If you're going to start using Google and searching for information, if you come across a blog from somebody else that you can relate to, we talk about patient community groups online. That could be another patient blog. It doesn't come naturally again to just sit down and start writing your story down. So again, teaching people how to do that is so key. And again, this is why we're working on that. Creating courses, creating tools, and so on to enable people to do it. Yeah.
And that's why I wanted to come back to Meghna, and just because this is the question next, how can health systems, better support women's health across different life stages, different socioeconomic backgrounds? Like, you can use the digital tools, but there are that digital divide. So how can women's health take advantage of that?
Thanks, Gareth. That's a great question. A big part of that is a lot of the advocacy work that we've talked about in here. Different healthcare systems will support women. That the change is the big divide. The digital divide is massive, as I've worked in health systems where the digital system is all about you accessing things online, so the information online, etc. But I think a lot of people will still struggle with that and need to see a health professional.
And also, let's not forget, 3 billion people don't have access to digital health, or any sort of health services at all. Like, Dr. Khadija is working in Africa, and I'm working across the African space as well, and in the South Pacific and across Asia, Latin America. Women don't have access to healthcare at all. So it's a huge challenge. And even in the UK and across Western society, we face significant challenges.
We do, and I think there's a big piece where people are moving towards less the global north, global south, and it is more high and low resource setting. You can be in a particular country and have full access to healthcare, but there will also be those that are more vulnerable and not have access to healthcare at all. And I can see, Khadija, you're shaking your head. It is true. Even in the UK, 1 in 4 women don't have access to menstrual health products, and that's the UK. It's a high income, very well established health system. So health systems do need to adapt, and I think there's a big movement, and one of the pieces that I particularly enjoy working on at WHIS is that there's also this component around well-being. So it isn't just health, and if you're sick you access healthcare. You need to access your health and look after yourself, and there are lots of other ways to access it. I know from some of the earlier conversations that you've had, Gareth, you can go through libraries, swimming pools, health centres, schools. One of the programs that is being run at WHIS is WHIS Kids, which is looking at educating children to understand who I am, that my health is important, and my well-being and mental health is important as well. I definitely see that there needs to be a shift in health systems to go from treating people who are sick to enabling us to access different parts of our well-being and health at different life stages.
Yeah, and also I'd like to bring in Dr. Khadija, just also before we go to final sort of thoughts from everyone. We had COVID-19. you know, we seen the lessons that were there. We worked very effectively in communities. Like, our ambition through WHIS is to give people the tools to manage their own health and well-being locally.
Mm.
Can we do the same from a women's health perspective? Can we work in local populations like you're doing in Ghana, for example?
Yeah, absolutely. I think it's so crucial, and it is possible to be done. We actually just wrapped up a program, a 7-month program focusing on young women's mental health and well-being, especially, but we tied that in with the leadership element as well. So we had young women across Ghana who were currently facing extreme circumstances, such as backgrounds, past suicidal attempts, and experiencing gender-based violence. So having a cohort of young women on this program over the past 7 months, focusing on their mental health, providing them with the coaching, but also the empowerment, every month, going through those sessions, but also at a point, reaching a point where we then provided them with some capital to actually implement community projects in relation to the same field, in order to empower others, knowing that, okay, understandably, this is what you have gone through in the past, but knowing that that's your past experience, that can actually serve you then in the right purpose, and empower other people to also perhaps not go through such situations. So I think it's definitely doable. It's so crucial. And for us, we've learned from the success of that program that, you know, similar to how you mentioned, just because the UK is in the West doesn't mean that nobody needs help. We're actually bringing a similar program to the UK next year for young women, especially young Black women, in particular London boroughs where the health inequalities are a bit more rife and access to healthcare is much more reduced, especially for mental health care access. We're bringing that program to these young ladies to also benefit from, you know, understanding the well-being, their well-being, as well as their physical health. And I think with medicine in general, a lot of what we're taught, even as doctors, sometimes we get bogged down by the fact that, you know, we must, you know, we're so symptoms and, you know, trying to find the diagnosis and give medication and treat, but we actually then underestimate, or I guess overlook the fact that we actually have a human being in front of us, and it's more than just the physical. There is a mental component as well, and it's that well-being aspect, their mental health. There are wider social determinants to health, not just in terms of the physical presentations that they present to you. And I think once we're able to, you know, provide that holistic healthcare for women in an equitable manner, because we all have different needs, then we'll be able to, I guess, make great progress.
Brilliant. I just want to come to just do a final round of questions. Just get your final thoughts about the future of women's healthcare. Let me go to you, Vanessa, first. Do you feel that there's an optimism, keeping in mind we do have serious challenges that face the health system at the moment? You know, do you feel that women's healthcare will come to the forefront? I certainly believe it should be at the forefront.
Yeah, I think that it needs to be at the forefront. You know, I just want to quickly share a story, if that's okay, because we're talking a lot about digital health in terms of women's health. And I think you know about my friend Sharifa, she used to be the director of Inspiring Women in Gauteng, South Africa. And she was also one of the founders of Dignity Dreams in South Africa. And so what Dignity Dreams did was they provided sanitary pads to young girls in school. And the reason that they did this, it was such a simple thing, right? It was such a simple thing. But the reason they did this was because these girls were going to school, having their periods, and having to, you know, not go into school for a couple of days because they didn't have access to sanitary pads. And it was such a simple solution, but it made such a difference to those young girls' lives. You know, and so that's why I want to just say, you know, it's not all about digital health. Digital health is absolutely something that can complement that kind of issue, but that kind of work is what we need to be doing on the ground to enable women, to empower women to become part of society. Because if we have, especially in LMRCs, if they are not part of the solution, we only really functioning on 50% or whatever percent of the population. So we need to empower them. So I guess that would be my last thoughts.
Yeah, no, I really appreciate it. It's such an important point to make, that we do have such gaps within the system. Let me just bring in Meghna. Meghna, your final thoughts on this topical area. We need big change. And there is a big opportunity here.
We do need big change, and there is a massive opportunity here. I mean, as we've touched on, women make up half the population of the world, and I do echo what Vanessa's saying, that there is an element that digital tools and health is one part of it, but there's also this last mile that we need to go, and there's some fantastic examples coming out of that. Vanessa, I just came across a lady last week who has been advocating in South Africa to remove the tax, and she's finally achieved it on menstrual health products. So that has been a big movement to make it accessible, but also other pieces, like, for example, I've come across an example where in Rwanda, a health information platform that is verified and secure so that women can trust it enables them to access medical abortions. And this is right down to that last mile, where you don't just read about it and go to a clinic and ring somebody up, but you actually get to know who is the clinician that you will connect with to help you do this. And then other examples that go the last mile are enabling women to have the finances. So, for example, in Cameroon, a woman will directly be given a health voucher that gives her full access to maternal and antenatal care, and that includes transport. So the voucher goes directly to the woman, and she has the transport funded to get to and from the clinic. It's these small things that actually make a difference. So we do empower the women, but we do it in a pragmatic way, one that makes a difference. Like, if I had to spend 2 hours traveling to a hospital, I don't care if my appointment's paid for, I just wouldn't do it because of all the challenges, and often the childcare, the work, and all of these are barriers. But if we are empowering women, let's do it in a way that works for them. That's really what I'd like to leave.
Absolutely. And I think that's a very important point. And if I bring in Dr. Khadija, just your thoughts on this in terms of empowering women and doing it locally. I mean, you have practical examples on the ground in Africa. That's what you're doing.
Yeah, definitely. Similar to what Vanessa mentioned, we, in terms of provision of menstrual hygiene products, we've done that for thousands of girls in Ghana and counting. And sometimes it's the little things that really matter. Knowing that, you providing a simple hygiene kits in our case, you're ensuring that girls stay in school for at least the next 2 years, which is so crucial. So I think just my last main point would be, as much as we are making progress when it comes to women's health on a global scale, I think we need to make sure that women within those contexts who are experiencing some of these challenges and barriers are given the space, the opportunity, and the resources needed to also come up with, but also implement the ideas and plans that they have for their own communities, because they know what it's like. So for me, that looks like being able to, for larger organizations, corporate, international NGOs, to work with those on ground in order to, I guess, provide much more tailored solutions for those for women in the communities, in order to improve their health outcomes as well.
Thanks very much. So, look, thanks for everyone who's joined us. Thanks to Meghna, Vanessa, and Dr. Khadija. Really grateful for everyone's input. I think the bottom line is we've got a lot of work to do. I know from an investment perspective, it's something like only 1.5% of investment is going into women's health and well-being. So we have a huge, shall we say, market and opportunity to exploit. It needs to be done. I'm very grateful for these leaders here who are demonstrating that it can be done. I'm excited to work with Meghna, Vanessa, and Dr. Khadija to make sure that happens over the next few years. don't worry, we'll be working on it. This is the second last session that we have today as part of WHIS Online. You can join us in about 15-20 minutes, grab a cup of tea for our final session, which is all about investment. So I do hope you can join us. And from myself, Vanessa, Dr. Khadija and Meghna, we look forward to seeing you at the next session. And thank you very much for joining us. So thanks, everyone.